Hi everybody, this is Dr. Lauren Molinar with Root and Bloom Chiropractic, and you are joining me tonight for a little pregnancy webinar. I know everyone is settling down for the night, but I want to take some time to talk about the essentials for having a healthy and empowered pregnancy. If you haven't noticed, we have been focusing a ton these last few weeks on supporting pregnant moms on our Facebook page, our Instagram page, as well as around the office. There are a ton of awesome details throughout these pages, so definitely check those out. So if you don't know me, like I said, my name is Dr. Lauren Molinaro, and I am a prenatal and pediatric chiropractor here in Clarendon Hills, Illinois. We have people registered from all over the place. So I just want to let you know that we do have resources and connections just about anywhere in the United States. So if you aren't local and you are looking for resources, certainly let me know in the comments or send me a message, call the office. I'm happy to get you to the right person. So let's go ahead and jump right in and get into the essentials for pregnancy. First up, my first essential is to pick an awesome birth team. Not just for labor, but throughout the entire pregnancy, as well as postpartum. There are so many options and choices, especially if you are in the western suburbs of Chicago. I feel like I meet new providers almost daily. So the question that patients usually ask me is, okay, so I know I need a birth team, but who is normally on a birth team? Who should be on my birth team? So right away, we're going to think of your OBGYN as well as your partner or your spouse. And this is a great starting point. Although in my experience, what I find is that the partner often has just as many questions, sometimes more, or is just really worried and they want more information themselves. This is why I feel very strongly that every pregnant woman and couple deserve to have a really awesome doula. A doula on your birth team is going to be your biggest emotional support, as well as give you a lot of the information that you want throughout your experience and your pregnancy and your birth. Another person that's really great to have on a birth team is a midwife. In Illinois, there are midwives that have hospital births as well as home births. Next, we recommend having a really good childbirth educator or instructor. So if you go take a class, there are a ton of different techniques, from the Bradley method to informed beginnings to hypnobirthing, from birthing from within. There are so many options, and it's really a personal preference. So I would say to definitely look into those, talk to your friends, see what their different philosophies are, and find one that resonates with you and feels like it's the best fit for you. But there are just so many options. Another great person to be on your team would be a prenatal nutritionist. This is really helpful for moms who want to make sure that they are not only eating enough, but that they're also eating the right foods and good foods. I've had a few patients with gestational diabetes and other health concerns, and they found that having a prenatal nutritionist on their birth team was very helpful and gave them the confidence to have a healthy pregnancy. And last but not least, of course, a prenatal chiropractor. I mean, hello, I am a prenatal chiropractor, and I love being a part of your birth team and preparing mom's body for labor. So those are a few of the common providers that are on a birth team, but there are certainly even more options that we don't have time to cover tonight. But I think this is a really good place to get you started, to really get your wheels turning and thinking about who do you want on your birth team, because it is your decision after all. So my number 2 essential is to start diving into some pregnancy literature, positive books filled with good, credible information. I have read tons of books on pregnancy, but I have 4 tonight that I want to cover. First and foremost, I have Ina May Gaskin. She's a very well-known midwife. This is called Ina May's Guide to Childbirth, and I really like this book. It not only talks about how to prepare your body itself for labor, but I would say the first over 100 pages are all birth stories. And I think that that is so valuable for women to read some good birth stories. I think women in the United States, including myself, are kind of brought up to fear birth. And that is why I'm so passionate about pregnancy and about giving women information and resources to have an empowered pregnancy and the pregnancy that they want. Another favorite at the office is Well-Adjusted Babies. This is written by an incredible female chiropractor in Australia. I actually had the opportunity to listen to her speak in July, and it was incredible. But this book is phenomenal. It goes through, you can see, it's got a lot of information in there with how thick it is, but it goes through so many different things. Oftentimes we have women that come in and they check it out from our office and they borrow it and they read it to cover. Other times they come in for an adjustment and they just look up a certain topic and read about it before they get adjusted. It's a great resource for mom through pregnancy as well as the first few months of the baby's life. Next up, my third book is one of my favorites. If you know me, you know that I love nutrition and talking about food. Dr. Weston and I are always talking about what we're cooking in our kitchen and new foods we're trying. But this book is called Real Food for Pregnancy, and it is incredible. It not only cites current research, it gives you information on good foods to have, prenatal vitamins. It also gives you recipes and ideas for what to eat. The thing that I love the most about this book is that she gives recommendations for prenatal vitamins, but she has you go to her website and get them on her website because, like I've mentioned in other videos, manufacturing companies and ingredients and quality of vitamins in general changes all the time. So she didn't want it in here in print because if the supplement that she recommends did have a quality change or manufacturer change, she didn't want her name to be associated with it. And I think that that is so incredible. And what I expect of other professionals is to be current and to give us the most up-to-date and the best information. So I really love this book. I think it's phenomenal. She also has one on gestational diabetes, if that is a concern for you. And last but not least, we have Mama Natural's Guide to Pregnancy and Childbirth. So this is a week-by-week breakdown of what to expect during pregnancy, different tests, and just what to expect. And I think that this is so great. It also goes through newborn tests and going through bonding with a new baby. Mama Natural also has a blog and a ton of resources online. So this is another great one and one that moms often talk about in the office. All right, so my next essential number 3 is all about lifestyle. How are you supporting a healthy lifestyle during your pregnancy? And the two biggest factors for this are, of course, prenatal exercise and prenatal nutrition. My biggest thing with nutrition is to eat real food, eat whole organic food, cut out as much as possible processed foods. This really helps to limit your sugar intake, your refined carbohydrates, as well as your sodium. Eating real food also helps support you and make sure that you're getting your vitamins, your minerals, and all the nutrients that you need for yourself, as well as for your growing baby. I talked about all this as well in a previous video, so definitely go back and review that one if you're interested more in nutrition. As far as exercise goes, a lot of women feel like if they didn't exercise prior to pregnancy, that starting to exercise during pregnancy probably isn't a good idea. And I would have to disagree with that. I think that, I wouldn't start any crazy workouts, but you can start exercising during pregnancy, whether, you want to go for short walks or start some prenatal yoga or prenatal Pilates. Movement is crucial for both mom and baby, and there are so many options. You don't have to, go to an extreme new physical routine or be overly physically fit and just overdo it, but there are simple things that you can certainly do. Sometimes our culture confuses pregnancy with a disorder, or there's something that limits you, but our bodies are, especially as women, are made for this. So obviously exercising has its limitations, as you know, as your biomechanics and your body is changing. And if you're working out so hard that you are peeing yourself, that is a problem. But that's why there are modifications for exercises. That's why there's professionals that specialize in this and make sure that pregnant women can still exercise and can still have a healthy pregnancy. And my last essential, saving the best for last, I think that you can guess what my last essential is going to be. Of course, that is going to be chiropractic care during pregnancy. Some of the biggest benefits are to reduce and eliminate discomfort or pain for mom, to support your body as it is changing physically, to make sure your pelvis is aligned. You know, as I've mentioned, all the ligaments in your body are loosening up. So we want to make sure that there is stability and there is a great foundation to build upon week after week or month after month. And this really allows baby to get comfy, to be in the optimal position. And there's also actually research that regular, consistent chiropractic care, with regular, consistent chiropractic care, there is a decrease in labor times and amount of interventions used. What mom doesn't want this? I'm not really sure, but I'd like to talk to her. But of course, a lot of curious moms ask me, when is the best time to start chiropractic care? And you know, if you're gonna ask me that question, I'm going to say right now, regardless of where you are in your journey, right now is the best time to start. Although I will say that the most common times that moms come into the office are normally about 20 to 25 weeks. Usually because at this time, mom's body is going through really aggressive physical changes and baby is getting bigger and there's just more going on. It's more complex. So this is when symptoms start to rear their head quite a bit. So with that said, we have moms that start chiropractic care before they're even pregnant or at the very beginning of pregnancy. I'm going to tell a little story about this in a little while, but when moms who are coming in for wellness chiropractic care and continue throughout their pregnancy, they have such incredible birth stories and they have just this confidence to them. And that is the experience that we want for every mom. I want every mom to have that experience that she wants and that she deserves. With that said, we have seen moms in the 11th hour of pregnancy, and we are certainly going to support them and make sure their body is absolutely functioning their best and that the nervous system is functioning and that she's feeling good and she feels like she has her resources. But obviously the earlier that we can start, the better. This really allows for optimal functioning of the entire body. As a prenatal chiropractor, I am working with your nervous system and making sure that your body is handling every stressor coming your way, both physical stressors, emotional stressors. And once labor and delivery comes, we want to make sure that everything is as relaxed as possible, and that the uterus is functioning optimally and that you are able to have that powerful, strong, empowered labor and delivery that you want to have. So I do want to tell that story that I mentioned a little bit ago about the mom. A mom came in during that 11th hour of pregnancy and she told me that she waited because she was pretty unsure about chiropractic care, and she'd basically gotten to her tipping point at 39 weeks pregnant. So she started getting adjusted at 39 weeks pregnant, and she told me that in the 6 days that she got chiropractic care, she felt better than she had felt the prior 39 weeks leading up to that. Pain during pregnancy is common, but it is certainly not normal. And now this same mom is trying for baby number 2, and she started chiropractic care before she even got pregnant to set the foundation. And this is just what we love to see. We love to see moms having the most comfortable and healthy pregnancy from start to finish. That being said, that wraps up everything that I want to chat about tonight in this pregnancy webinar. Thank you guys so much for tuning in. I hope that you gained some information tonight and just got your wheels turning of things that maybe you haven't thought to look into that maybe now you want to look into. If you registered for the event, you will be getting your local resource list shortly. Please reach out with any questions. We are always happy to help you and be a resource for you before pregnancy, throughout pregnancy, and afterward. We really appreciate you guys, and looking forward to chatting soon. Have a great night, everyone. Thank you.